our today's class is quality control and patient safety, and it will be the overview of the subject where we will discuss the basic of the subject. There are three units in this subject. In the first unit, we will discuss about the quality control, about the safety measures in the hospitals, how to improve the qualities. All these things we are going to cover in the unit one. And in the unit two, we will cover some first aids and how to save the patient, some emergency, some techniques we are going to study. And in the fourth unit, CPR. Okay. So all these things we are going to cover. It will be just basics. We will not go into the detail. First, I will cover the basics and details you will get on the LMS. There are the videos. You can watch the video and then you will get back to me. Then we will discuss your doubts after that. Fine. So today we will discuss the basics about quality control and patient safety. So here are first content where we will discuss about the quality control, right? Quality improvement. So if we are talking about the quality here, so what is the meaning of it? Basically, we are talking about the improvement of the qualities, like improvement of the materials which we have in the hospitals, or improvement of the methods, right, which we are following in the hospitals. So how to improve that and what steps we should take to improvement of these, right? Because you know that if we are talking about any hospital, so what should happen? In the hospital, their management should be good, their communication should be good so that the patient will feel comfortable, and their quality should be improved whatever they are using for us, right? Why? Because the improvement will be better for us. If they will be right better in the quality, then we will get the better treatment. Fine. So here, first we will discuss about the content of care, where the evidence, which is the evidence based, right? The standards, protocols, and guidelines. When we like in any hospital, if there will be having any material, if they are using any methods, right? Whatever, if they are using any machine there, so they should be having the evidence based of the standards will be there for that particular thing. There will be some protocols like how to do it process, right? Then guidelines, which is very important to follow the guidelines when we are using anything, right? So this is about the content of care, कि care का जब हम करते हैं तो what we need to, like we need to keep in our mind, right? Now from there, when all these things are happening, then it will go to the it will go to the here, and here the process of here content of care. Now it will be the process of care, how the process of care will be going on. So here first we will see the quality, and then if there is any problem and anything is not according to us, then we will go on the improvement. We will think about it how to improve it. Then we will go on the methodology, like how we are doing it. Fine. So here the continuous quality improvement. So the quality improvement will be continuous in the hospitals, right? It should be like continue. If there it should not be like that once in a month we will check the things and we will improve it. No, it will be on a regular basis, right? So just take an example. If we talk about the sterilization, I know all of you are knowing about the sterilization, which is a method to kill the harmful microorganisms from the surface or from any material, or if it is present, right? So it is a process of sterilization. So we know that we do sterilization on regular basis. If we are using any particular scissor also, the next day we will sterilize them. Why? Because any microorganism can get into the contact of the particular material, right? And if we are using it for the patient, then they will get infection, right? So that is why we are doing it. Same like that. What is the important? This quality improvement is important on regular basis. Continuous quality improvement is important as sterilization. जैसे sterilization is important on regular basis, like that, right? Traditional quality improvement. Now here Like when we are doing it, then what should we will keep in our, what are we are trying to accomplish. First of all, we should know, we should aware about that कि हम क्या करने वाले हैं, what we are trying to accomplish, right? Then we will check how we will know that the change is an improvement, what we are changing in our material, changing, if we are changing anything in the quality, then how we will get to know it is improvement. What if it is not improvement, what if it will get worse then, right? So this is also important, right? When we are taking any step, so we will think about it in future, is this any like is this is a growth, is this is an improvement what we are doing today. Like, just take an example. In the last semester, suppose you haven't studied well, you haven't studied well, you didn't prepare for exams, you didn't ask the doubts in the class, then what you will think for the next semester? You should take regular classes, you should watch videos on the LMS on the regular basis, you should like attend the classes, join the classes when there will be any classes for the questions, important questions, right? Then you will improve yourself. You know that now I will do this, then pakka I am getting improvement in myself, my exams will be good from the previous one, right? So like that only, whenever we are going to do any changes in the hospital, any changes in the material of the hospital, we should know about it, right? We should always think this is an improvement, right? Then only we will take the step. If you are, if you know that if you will not prepare for the exam, you know that your exam is not going to well, not going to be nice, right? So what you will think? I will prepare for my exam. So you know that it is an improvement in yourself. Fine. So I was actually wanted to make you clear that if there will be any change, so is it a improvement or not? That is why I'm giving you the example, your exams example, so that you will get like more clear when you will correlate with them. So now, what changes can we make that will result in an improvement? So our next we will think about the what we can change for the improvement what we are seeking, right? So first is we will plan, right? We will plan, change or taste, like what we should change, right? So then we will carry out the plan, we will carry out our plan, then we will study, we will summarize what we have learned by planning and doing, right? So when everything will be clear, then we will act, determine what changes are to be made, then we will act ki what ki हमें क्या change करना है, and we will definitely do this. Fine. So this is the plan, do, study, act, which is important when we are thinking about any improvement. Now quality standards. अब आपकी जो quality के standards है उसको कैसे improve करेंगे? What are these quality standards? So first we will discuss about the customer focus, right? So customer, if you are dealing with like if it is if business or if it is in the hospital, so first we will focus on the customer, right? Customer, who is the customer here? The patients. If our hospital's management is very good, then only patient will come to us, right? We know that if we are going for any treatment, then what do you think? No, no, this hospital is better. No, no, this hospital will better, right? We think about it, right? Before going to like for treatment. So we choose our hospitals. So the qualities, standard quality should be improved, right? So here the customer focus, if the qualities will be improved, the customer focus will be on you. Leadership should be there, engagement of the people, how to engage with the people, how to talk with them, process approach, whatever we are doing, the process should be good, approachable, it should be approachable. Improvement, continuously improvement should be there. If there is any mistake, then it should not repeat again, right? So this will be the improvement. And we are checking, we are regular, on the regular basis we are doing the improvement in our system, in our materials. Evidence based decision making should be good. And relationship management, how you are managing the relationship with your management. So this is important, this is your quality standards. When these things are good, then definitely you will get a growth, right? Now, introduction to BVM. It is basically in before slides we discussed about the quality standards, quality improvement. Actually, we were focusing about what is the quality basically and why it is important to improve, right? Now in the unit 2, there are some like materials which is important, right? Which is emergency materials we need, actually we required in the hospitals, right? uh, because emergency can come anytime, so these should be present there and their quality should be good. So first we will discuss about the BVM, right? So BVM the full form of the BVM is bag valve mask, BVM. So sometimes we known it by the proprietary name, which is the ambu bag, right? Ambu bag. So we, but we will call it ambu bag, or generically as a manual resuscitator, right? What is the meaning of resuscitator? Basically, this is what is the meaning of this? When we are saving a life in the emergency, right? When we are improving, when we are saving a life, when something is going to be dead, right? And we, what we are doing, we are trying to like trying to improve it. We are trying to basically we are trying to do something so that it should not, it should breathe again. Sorry, it should not. Patient will breathe again. Fine. Or self-inflating bag. So basically, BVMs means resuscitator. So it means when there is any problem, when a patient is going to be die, so when we will use the BVM, then it will be helpful for them, right? So it is a handheld device you can handle with your hands and commonly used to provide positive pressure ventilation. Basically, you will provide the positive pressure ventilation, means air to the patients, right? To patients who are not breathing or not breathing adequately, who are not breathing continuously or not breathing normal, or the patient who has stopped breathing, then you can use this. Sometimes it can save the life also. Maybe the patient can breathe again, right? When we you will do this. So here the parts of the bag valve mask. So in the unit wise videos, you will get more detail about it. So, but I will try so that I will try to cover most of the things so that it will be beneficial for you. This is the pop-off valve. Fine. This is self-inflating bag, which you can like where the airs will be filled, and air inlet one-way valve O2 reservoir shock. This one is, and this one is the tubing where the oxygen will be present. Fine. This is the air inlet and pressure released valve from where the pressure will be released, and this is the reservoir bag, right? Reservoir bag. So this is the parts of the bag valve mask, which is important for to and to make the patient breathe. If they are breathing inadequately or if they are not breathing, then this can save a life, right? So that is why in the hospitals, doctors will use this, and it is used in very critical conditions when any emergency will come. Then we use this. This is the CPR guide basically. And okay, so basically CPR, in the CPR, when what which is the condition when we give the CPR. So basically the thing is when someone is stop breathing and they are unconscious, then we will do the CPR. So first of all, what we will do, we will shake and shout. We will shake them and we will shout, right? And the second step is we will call 911 first of all, so that they will come. So while waiting for the ambulance, what we will do, we will check for breathing. We will check is the patient is breathing or not. If not, then we will place our hands at the center of their chest. We will place our hand, you can see the picture like this, and we will push them. We will push them harder and very fast, right? and we will do it in twice in per second. In a second we will do this two times, the pushing. Okay, so if you have training repeat cycle of 30 chest pushes and two rescue breaths, so if you will do this, so what will, if you have done any training, so what we will do, our repeated cycles of 30 chest pushes, we will do 30 chest pushes and two rescue breaths, right? So, and in this time, if if still they are not breathing, so what we will do? We will give them mouth to mouth breathe, right? Air, so that they can breathe, and then we will push again on their chest, right? So this is the CPR. When there will any kind of emergency will come, then we can use this. Then we can do this, right? Next is first aid triage. Basically, what is the meaning of first aid triage is the emergency cases, right? So it is the when the patient is required the treatment, where to require the treatment, which kind of patient, which kind of treatment they are requiring. So this is known as the first aid triage. So there are some levels of triage, this emergency conditions, right? So you can see here immediate help. So as you can see in this picture, there is what you can see here, there is an accident, so what they require, immediate help they require, right? Whoever is in the car, they need to we should always what to do, we should we should transfer them to the hospital immediately, right? And in the level 2, this is the emergency 15 minute, like so here they are delivering the baby, so even they get to facility. So within 15 minutes, within 30 minutes they should be in the hospital, right? And this is the level 3, and there's the 30 minutes. So 30 minutes से कम में, less than 30 minutes we should do this. If someone is having heart pain, heart attack. Level 3, less urgency. This is if you any cut or anything in your hands, then fine, you can wait for some time, because it will not be a kind of loss. You cannot, like in these conditions, what can happen? A life can be in the life will be in, it will be terrible, it is not safe. And in the level 5, if you're any stomach pain, any kind of something, so it required less time, more time, matlab, you no need to hurry, like in these conditions. Level of triage, so here we will discuss all the level. Patients with life threatening or critical conditions, the patient which are dealing with their life, then this comes in the level 1, where the very immediately we should transfer them to the hospital in these conditions. In these conditions, this is the level is immediately bedded, right? Very important level, where the patient's condition is very critical. And then level 2, which is the high risk patients. Though here the patients will be having a very high risk, anything can happen to them, right? So these patients are experiencing severe pain or sickness, right? So this comes in level 2. In level 3, there is stable vital signs but significant, right? There will be some stable vital signs will be there, but it will be significant. Sickness is present, you will feel like sick, and often more than two rescue are needed to make patient disposition. Fine. Now, level 4 is the low risk patient with stable vital signs. There will be risk will be low as compared to the other levels, but the one resource is needed to make patient deposition, often treated through fast track if available at the facility, right? If there will facilities available, so of course we should keep in mind, if there is any problem, we should always take it serious, right? We should take care of them, right? Level 5 is the very low risk patient with stable vital signs. There will be stable vital signs. The risk of the death will be very, very low. so there is no need of resource are needed, किसी भी resource की कोई जरूरत नहीं है. And also the example, if a patient needing a prescription or a patient needing a stitches, right? Cut, if then cut stitches, or if there is a any prescription they require any medicine and all, so they can wait. Patient are this level are often seen through a fast track if available. Even the patient have seen fast track, matlab they have get transferred to the hospital immediately if there is availability will be there. So in all the cases, the patient should get transferred to the hospital. Patient should get the treatment immediately. But yes, level one, two, three is very, very like sensitive levels where the life of the patient will be in like they will it will be very sensitive, crucial phase of their life. Now coming on the choking, choking basically it is an obstruction, right? It can happen in your this trachea while you are eating, while you are talking, so it can happen immediately. So there will be the flow of air from the environment to the lungs. The obstruction of the flow of the air into the lungs, right? So when you are breathing, so you will not able to breathe is the in that particular time. So choking prevents the breathing. So it will prevent your breathing. You will not able to breathe and can be partial or complete. So it sometimes it will be partial, means within some time you can breathe again and then it will be stopped, then again you can breathe, but it will be slow breathing. But in some cases it will be permanent, permanently you will not able to breathe. So although inadequate flow of air into the lungs, okay, it is happens when there is inadequate flow of the air into the lungs. There are some symptoms of choking. When how you will get to know someone is having the choking, so the person cannot speak, and their face will turn into the blue color, and the person grabs at their throat. Right? They will grab like this on their throat, and they will have like has a weak cough, right? Weak cough with a high paced noise. So there will be weak cough, but the noise will be highly paced, right? And does all of the above and becomes unconscious. They will after that all these happens, then they will become unconscious. They will don't have any sense, right? At the time. So if they become unconscious, then what happened? So we should tilt the victim head and lift their chin. We will tilt them and chin will be upper side, and we will apply the pressure to the forehead here like this, to tilt the head back and lift the chin, right? Then if keep head titled back and pinch the victim's nose, we will pinch the nose of the victim and shirt, and we will seal our lips tightly around their mouth, right? And give two full breaths to 1 to 1/2 seconds. We will give them breaths, right? Like this, you can see in the picture. And we will allow to chest to full deflated between the breaths. तो उनके जो चेस्ट हैं उसमें एयर्स को फिल करने के लिए we do this, right? So start with two rescue breaths. We are starting with the two rescue breaths here. This is the condition, and this is how we will do this. Fine. Now, this happens when someone else is like choked, right? So we can also help ourselves when we are suffering from choking. There is self-treatment. How we will do it when you are alone? So you can see this picture and right standing, they're standing and they're tilt bit. And if you're alone when choking, when there is a choking and you're alone, so then you can give yourself abdominal thrust like this. They have put their abdominal on the chair and try to expel the object. You are trying to expel the object, right? And you will lean over and push your abdomen against the back of the chair. So you will push the abdomen against the back of the chair, right? And then what will happen? Table or other firm object. So you can use any table, other firm object, and the position should be like this. You will like push back the chair, like against the chair, right? Pushing will be there against the chair. So what we have discussed about the choking, about the CPR, and about the levels of the triage, right? And we discuss about the bag valve mask, which is also important to save a patient's life. It is useful to make them breathe again, right? So this is in today's lecture, this is what you have understood. I hope this is everything which we have covered today. You have understood. I have a one more slide for you, which is the CPR again. So I will tell you again it. So this is the call 911 as I told you, someone else too, right? And the second step is we will lay the person on their back and we will open their airways, right? And the next is the if they are not breathing, then we will start the CPR. CPR is the chest compression we will give them, right? 30 chest compressions we will give them, and two rescue breathe. Two times we will give them mouth to mouth breaths, and then we will repeat until an ambulance or AED arrives. Until the ambulance will arrive, we will keep doing this to the patients. Fine, students. I hope the CPR is clear to you now and other things are clear to you. So basically, why we are doing this to improve the quality, to improve the patient's uh, health, right? All these things we are doing, and we will, as I told you in the starting only, all the materials which is present in the hospital, they should be checked regularly if is there any problem with them, if they are not working, if they're working properly or not, because emergency can come anytime, right? So we can we can require that particular um, that particular materials. So in the emergency, if it will not available, then so that is why we should keep checking them so that we can improve them if there is any problem. Fine, students. So thank you so much for listening the lecture very nicely.